Hi, my name is Eric Roof. I'm the Chief Executive Officer of Barber Community Health, and we're here today to talk with two experts about something called a Medicare Annual Wellness Visit. And we want to learn more about that, and we wanted to share that with the community so that you learn a little bit more about it and hopefully learn enough that you'll want to take care and take advantage of the opportunity to do that. So the two experts I have with me here today are Amy Chenoweth. She's one of our nurses here at the Belington Clinic. And then we have Jamie Carpenter, who is one of our nurses at the Myers Clinic. Amy, I'm going to start with you. What is a Medicare Annual Wellness Visit exactly?
It is actually a preventative plan that is in place with your provider. It's a visit that we make sure your chart is completely updated. We want to make sure your screenings are done. Everything that you should be getting, like your immunizations. We want to go over your medication list, family history. We basically are updating your whole chart. And depending on your health, will be what screenings you get.
Very good. Jamie, who gets a Medicare Annual Wellness Visit? Who is it that has these or should get them?
Anybody that has Medicare coverage for their insurance, they're eligible for the annual Medicare Wellness Visit.
Okay, and it doesn't matter what kind of Medicare it is, whether it's an Advantage plan or any Medicare plan.
Right, as long as they're covered under Medicare, yes.
And Jamie, will it cost them anything to have this visit?
It does not. It's a free annual wellness visit.
Very good, very good. So Amy, kind of talk me through a little bit of the process. How does it get started? If I have Medicare, do I call you? Do I talk to my provider about it? How does it get started?
You can actually call me at Billington Clinic. Just ask to speak with Amy. They'll put you up to me. If you come up on my list to call, because I do have a Medicare list, I do try to call all of our patients that have Medicare, especially when they get Part B, because Part A and B is when you're able to get those. And then I'll update your chart over the phone, and then you'll come in to see the provider. But the basic thing is if I have not gotten a hold of you and you decide, hey, I want to do that, give me a call and I'll get you in for that.
Cool. And Jamie, is that the same for you? If I happen to be a patient at Myers, do I call you for that?
Either myself or Melissa at registration.
At registration, and they can help get the connection going and get us together.
Yeah.
So, Jamie, was there any special training or certifications or anything like that you and Amy had to go through to be able to perform these or get them started? Or
we did have to do the Alliday trainings, and we're both licensed practical nurses, so that we're certified that we're able to complete the Medicare wellness visits.
That's very good, very good. Alliday, just for folks that are watching, is a organization we work with that kind of helps us put all of the data together for these visits and helps us make sure we stay in touch with folks. So tell me again, Amy, what specific screenings should I expect, or what are you gonna look at my ears? Are you gonna take my blood pressure? What's gonna happen during one of these visits?
And so I will do my part over the phone, which is basically I'm taking all your health information and getting everything updated. Then when you come in to see your provider, you will get vital signs, depending on which Medicare appointment you come to, because the welcome, you can actually get an EKG as well at no cost. But it's going to depend on your health, because men and women are different. So women may get their mammograms, DEXA scans, and men, of course, will need PSA checked. And we do, we want to make sure you're getting your colonoscopies. That's very important. So it will depend on your health and your age.
Jamie, you've done several of these with several of the patients there at Myers Clinic. So, what's been the reaction? Are people find these a positive? Has it been have most of the patients you've met with felt good that they did can't speak, did they feel good that they did this?
They have. I've had a lot of return too for they've had their initial and or their welcome completed, and they're going ahead and scheduling, getting ready for the next one next year that's due.
So they do them again how often?
Annually.
Annually, once a year they can get this done. And so any obviously don't name names, but any positive stories that have come out of this, that maybe somebody took advantage of this visit and that something showed up that they weren't aware of, that it's helped them? Have you had any of those experiences?
We referred a lot to the health educator here that's helped with the diabetics and meal planning. I've had a lot of people take advantage of that.
Good. Amy, how about you? Have you had a good positive response and reaction from the patients as far as, glad they did it, and did they find something that maybe they didn't know about?
Yes. Number one, they love that they don't have a copay for this visit. So you're coming in, and you can see your provider and it's free. They really like that. As far as people coming out with a positive case with this, I think it's great because they're being educated. A lot of people don't understand what screenings they should be having. They don't know what shots they should be getting at, certain ages. So it's very educational as well. So I have a lot of patients that really like doing this.
Very good. Very good. And final question, one for each of you. I'm going to start with Jamie. So you had worked in the Myers Clinic for many years, and we appreciate your service with us. Why did you want to make the shift to do this particular service for our patients rather than where you had been working with Dr. Holbert for a while? Why did this appeal to you?
For me, I get a little bit more patient interaction time. You're not rushed. You can sit down and go over their chart and do a chart review with them, and kind of take a little more time, a little more face-to-face time with the patients. And I enjoy that. So
Good, very good. Amy, same question for you.
I agree with Jamie. I've learned a lot from the patients that I used to just put in a room and have 5 minutes with. I'm able to talk to them on the phone. Jamie and I have a little bit of a different position because the way her facility is set up, she sees them face to face, and I usually just speak with them on the phone. But I really enjoy talking and learning about my patients and helping educate them.
Very good. All right. Well, thank you both very much. It's been very helpful, very educational. I'm not of Medicare age just yet, but it'll be coming soon. And I hope you both will still be around. You can help me with my Medicare Annual Wellness Visit when it comes in a few years. So again, thank you both very much. And to the community, hope this has been helpful. So if you have any questions, please don't hesitate to give us a call at either the Myers Clinic, 457-2800, or the Belington Clinic, 823-2800. Ask for Amy or Jamie. They sure can help you out. And as always, at Barber Community Health, turn to better healthcare. Thank you.